millions use melatonin. This paper set out to prove, mathematically, that it actually works. The researchers didn't just run a single experiment, they pulled data from multiple clinical trials to get a definitive overarching answer. It remains one of the most cited reviews on the topic. But there is a quiet detail operating behind this study that completely changes how you read it. The meter is empty. The investigation starts. You always start by checking the neighborhood. Sleep Medicine Reviews is a highly respected, top-tier scientific journal. Getting published here requires surviving a tough, demanding peer review process. A premier venue checks out. Dropping down the page, we hit the first real numbers. They report that melatonin reduced sleep latency by 4 minutes, but notice what comes immediately after, a bracket of numbers from 2.5 to 5.4. That is a confidence interval, the range of likely true values. When researchers just use a single pass-fail metric called a p-value, it's easy to game the system to barely cross the finish line. Think of throwing darts at a target. A p-value just claims you hit the board. A confidence interval forces you to show the exact spread of your darts. They showed their spread. Solid statistical safeguards. Exactly right. Next page, we need to see how they picked the studies for this review. They set a ruthless standard for entry. Every trial they included had to be double-blind, meaning neither the patients nor the doctors handing out the pills knew who was getting the real thing. Even better, they threw out studies that just asked people how they slept, demanding objective machine measurements instead. Because this is a review of existing studies, the strict inclusion design itself is doing the heavy lifting to keep the data clean. Rigorous blinding and design. All clear. But there is a catch to all this pristine screening. The authors state that their analysis relies entirely on data from other published papers. What they don't provide is their own extracted dataset, or the code they use to run the math. You just have to trust that they copied the numbers over correctly, and since this paper was published before modern registry rules existed, there is no pre-written protocol to verify their steps against. Raw data availability? Nowhere to be found. Jumping to page 4, we catch the authors making a mathematical choice. Some of the original trials they looked at were missing specific error measurements. When a researcher hits a gap like this, they have a choice: guess favorably or assume the worst. Think of budgeting for a trip. If you don't know the exact cost of dinner, you estimate high so you don't accidentally run out of cash. These authors used a mathematically conservative workaround, intentionally handicapping their own results to be safe. Careful! Defensive math. No issues here. Below, the charts back up the math. This is a standard layout for a meta-analysis. It clearly shows how multiple different trials stack up against a zero-effect line. The layout is clean, the scales are proportional, and there are no visual tricks to make the results look artificially impressive. The visuals are clean, straight execution. We've got more studies queued that will surprise you. Subscribe so you catch the next one. Next page, we verify the final tallies. The body of the paper details how melatonin significantly reduces sleep onset latency. Jump back to the abstract on page 1, and the numbers are a perfect match. Every decimal point aligns, with no exaggerated language or spin attached to the findings. Internal consistency is verified. Clean reporting. Up to this point, we are looking at an exceptionally careful review, but the most important sentence is on page 6. Read the funding section. They list grants from the government and academic trusts. There is no obvious commercial sponsor anywhere in this paragraph. But the story changes the moment we look up the lead researcher. Senior author Richard Wertman holds a patent on using melatonin to induce sleep, and he founded a pharmaceutical company specifically to commercialize it. He holds a massive financial stake in proving this pill works, and it is never disclosed to readers. The independence story gets complicated the moment you look outside the paper. The math is pristine, but the motives are obscured. Where does that leave the science? This study proved that melatonin reduces the time it takes to fall asleep by 4 minutes. And because the methods were genuinely strict, multiple independent labs have since confirmed that finding holds up. But the senior author hit a massive financial conflict of interest from the scientific community. 80 out of 100. That's a study that did the science carefully but failed its disclosure obligations. The takeaway is simple. If you want to prove melatonin works, cite the independent labs, not the guy holding the patent.